exercise number 1, still lie on your side and do the intra-abdominal pressure breathing. Turning the head from side to side, and you do the breathing. Feel the expansion on your belly and then on your back as well. Hold the pelvic floor in, count from 6, 5, 4, 3, 2, 1, and then exhale for 6, 5, 4, 3, 2, 1. Once you have done for 5 to 10 repetitions, then you turn around to lie on your back. Okay? When you're in the back position, you want to start with bringing the feet down. Knees and feet about hip width distance apart, palms to face up. Feel the shoulder blades are on the ground. Chin tucked to the neck. Always look towards the knee, in between the space of the knee. Okay? Now with the feet on the ground, you start to bring one at a time away from the ground. And we want to seal the arch on the lower back. And therefore you can push the elbows, push the palms down to lift the tailbone up, bring the tailbone down to feel that's absolutely flattening on your lower back. So your lower back is flattened, knees are fairly close towards the chest, the feet are soft, knees in its isolated position, knees may be close towards the chest. Quite, it's not perpendicular to the hip joint yet. Then keep the chin down. Start to work on the intra-abdominal pressure. Just breathe for 3 to 4 times until you feel the pressure up again. Then bring the palms facing each other, kind of like hugging a ball in front of the chest. There should be no tension or whatsoever on the whole arm. You are pushing the shoulder blade down. That is the base of support. The base of support is from your shoulder all the way down to your tailbone. It's the whole rectangle's trunk that you feel. The whole trunk is glued on the table. All right. So this is you can keep in this position and start to work on your breath again for 5 to 10 breaths, or you can then proceed once you feel confident. Then you start to move your knee joint directly above the hip joint. The calf is parallel to the floor. When you are pretty confident with that, then you isolate this joint, move the other. And want to make sure that the chin tuck, at this point, you will feel that you need to use a lot of core strength, okay? So if it starts to shake, it's good because you are working on the abdominal muscle. So palms to face each other. So this would be good position. When you are pretty confident in this position, you can always rest by bringing the arms and the legs down. All right. So I put after a couple of breaths when you're ready to move. All right. So there are a lot of variations on the arms and the legs. The idea is to isolate the joint, not moving the trunk. Okay. So variation number 1, it could be. Can you just stop the video?